So health is a really exciting market right now, and historically you wouldn't look to health as a market of innovation. It hasn't historically been a early adopter of IT. It hasn't been a market that really has been leading the charge in the use of technology historically. But all of that's going to change, and all of that is really changing already because of the underlying economics of the business. Historically, what have industries done when they get in trouble on the expense side, when they have variability, when their market segments are kind of under attack from economic forces? They get focused on quality and cost containment. Okay, those are the two real watchwords in healthcare right now. I have to improve the quality of care, and I have to do it in a way that reduces my costs. So we see two significant changes in the market being driven by that. The first is better using what we already have, and we think of this as personalized health. Okay, we have tremendous amounts of data in healthcare right now. We just don't use it well in designing and delivering care. Okay, we haven't used it to figure out who's the best treatment for this individual patient. We haven't used it to create unique courses of care for this patient based on their biology, based on their genetics. So we see this merger of knowledge management and advanced technology to create new therapies and to create diagnostic tests to determine who should get those therapies, using techniques like digital imaging, molecular imaging, PET scans, CAT scans, all kinds of new science really brought to bear to better understand disease and the mechanisms for disease in the human body. On the other side of that, we have really well-proven cost containment and quality initiatives from other industries, where we look at the outcome. We look at the quality that results from a process, and we try to improve that process so that we can get better outcomes. Okay, in the payer world, this is called pay for performance. And what we see reimbursement agents doing is really looking at the quality of care from an outcomes perspective. What patients did the best? How is that correlated to choice of physician? How is that correlated to choice of hospital? How is that correlated to course of care? And we begin to link the therapy, the provider organization, and the physician as components of quality in healthcare. They're going to actually change their reimbursement rates based on that. They're going to change the referral mechanisms based on that. So now when an individual goes to their insurance company and says, where should I go for care? That's going to be driven by who produces the best quality.